Maverick Physical Therapy Maverick Physical Therapy. I wanted to share a couple more strategies that I like to use for TZ1C of throwing or kind of pitching mechanics with some lunge kind of progressions. So I'll take this LXI position of the sagittal plane lunge and I turn it into a pick and a press. So just a straight general pick and press. Nothing too fancy. I can set myself up into, like I've shown before, into TZ1C and go with this eye. Fixate my head on my target to get a little more cervical spine mobility, or I can take it with my hands that are pressing and I feel it a little bit more in my scap and thoracic spine there. So I'll either preset or boom, I'll go into my lunge, and now I'll go into my lunge, fixate my gaze, go in with the eye, and boom. Single leg toe touchdowns I'm a great fan of in terms of our picking and pressing. We'll go left leg, we'll start with the point forward, we'll go left anterior lateral and left lateral for a reach to load up the internal rotation of the left hip. What we can also do as a strategy to load up that flexion, internal rotation, adduction a little bit more, is to two things. Take a little step into the single leg toe touchdown. So take a little step into it and explode out. We can also go with a big eye. So we can preset this LXI in which you're mostly weight bearing, that left lower extremity, and or we can kind of step or lunge rather into the single leg toe touchdown, giving us more internal rotation at the left hip so that we get better extension through that left hip towards our target as we eventually release the baseball to finish things off. Have fun playing with those.